Hi, I am Dr. BV Balachandra, consultant pediatrician and allergy asthma specialist.
Hi, I am Nitya, working in Chirai Multi-Speciality Clinic, your allergy asthma assistant.
Today, we will be discussing on how to use an MDI with the spacer. MDI with the spacer is generally prescribed above 4 years of age, and this can be used for at any age, even an old age patient can use it. It is very important to use an MDI with the spacer. The lot of advantages are: one, you don't have to coordinate, you can do it in a comfortable way. Two, more medications will go into your lungs. Three, the medications which will otherwise get deposited in the throat, in the mouth, will not happen significantly, and much more medicine will go deeper. The medicine effects or a fungal infection which can develop because of the medication is significantly less when you use a spacer. So the benefits are much more, and even the mildest of the side effects are significantly less when you use a spacer. Now we will go step by step on how to use an MDI with the spacer. Now spacer comes with a transparent chambers. It usually comes in a two parts. You may have to join these two parts and lock it, and you will have a covering where the mouthpiece. You may have to open this mouthpiece and fix the inhaler. Before you fix it, shake it very well, at least 4 to 5 times vigorously. And if you are using it for the first time, you may have to let go 2-3 doses, but don't let go every time whenever you are using it. This is only when you are using the MDI when you purchased from the shop first time. Only those time you will be leaving the medications outside. Otherwise, you will not waste the medications. You will snugly fit the MDI with the spacer. Now Nitya, so before actually taking the medications, so Nitya has to blow the air out from her lungs so that her lungs are empty. Nitya, blow out the air. Okay, so Nitya is emptying the air from her chest. Lift the chin little bit. Okay, keep the spacer into your mouthpiece. Okay, hold it tightly. So now you can press the canister, and Nitya is inhaling it slowly and deeply, at least for a few seconds, at least for about 4 to 5 seconds she has to take in. Now Nitya will take out the spacer. Okay, she is holding her breath inside, closed her lips. So she has to hold like this as long as possible, minimum of 10 seconds, but if it can be holded up to 15 to 20 seconds, that is good. So after holding it for about 10 to 15 seconds, she has to release the air through the nose. So the expired air should come through the nose. So now this is one dose is completed. If your doctor has advised 2 doses, you may have to disconnect the MDI, shake it very well again, okay, and then fix it, blow the air out, keep it inside the mouth, press, take a deep, slow breath, remove the spacer, hold it for at least 10 seconds, but if it is possible, hold it for more longer than that, and then after 10-15 seconds, release it through the nose. Now this is what is a single breath technique of using an MDI with spacer. Now once you have used it, you will disassemble it. Okay, this spacer needs to be washed once in a week with a normal water, not hot water. You may use a gentle soap, and once you wash it, hair dry it. Don't use any cloth or anything to wipe it, just air dry it and use it for the next time. And before you use for the next time, make sure that there is no moisture. Another important point is, whenever you use a MDI with spacer, you need to drink some amount of water. Normal water is good enough. Do a gargling as if the water has gone into the throat. Gargle and spit outside. This will reduce the medications which is stuck to the throat. However, small children like 4 years, 5 years, they may not be able to take it to the throat, but whatever best possible, you need to give them water to gargle and spit outside. Also, another important point, to make sure that this spacer is replaced once in 6 months, so that the medication which is used goes into your chest. Otherwise, the medication might get stuck to the walls of the chamber. So I hope MDI with spacer, how to use it, we have shown it. And the most important point is, if you don't use an inhaler in an appropriate way, you will not get a good response. You might be using the correct medications, but you may not get a good response. Thank you.
Thank you.